Let's talk about the vaccine rollout, which at times has seemed pretty irrational. I mean, the vulnerable are almost exclusively the elderly when it comes to this disease, and most of the over 70s have had a chance of getting the vaccine, which is great. After that, with them protected, we really ought to have no lockdowns, heavy restrictions or state border closures ever again unless something gets really out of hand. But as I went through earlier, most of the states are run by hysterical opportunists at the moment. Still, once the over 70s were taken care of with vaccinations, the logical next cohort would have been the over 60s, of course, and then the over 50s and so on. But no, we ended up with concerns about AstraZeneca and blood clotting, and instead of offering older people the choice of Pfizer, we recommended against AstraZeneca for under 50s and expected the over 50s to take that vaccine, while we've allowed younger people to get Pfizer. I reckon this is pretty silly. If you want older and therefore more vulnerable people to get vaccinated, give them their choice of vaccine. Now, people like me in their 50s who have been ambivalent about AstraZeneca have been vindicated now. Like some other countries, we're now going to recommend it only for those over 60 because there's been a number of blood clotting incidents. So the 50-somethings like me now can have Pfizer if we can find a jab somewhere because supplies are short. Happy days, eh? Well, the over 60s, though, I'm worried, are still going to be concerned about AstraZeneca, and therefore the take-up with that could be held back as well. And, of course, supplies of Pfizer are limited too, as I mentioned. So this is all going to slow down, you would think, the rollout even further. Now, the other point that I think is about this is probably even more important, and that's the incentives for vaccination and the fact that they're just not there in this country at the moment. If we have a virus elimination strategy, there's very little incentive to get vaccinated unless you are elderly, unless you are at risk of serious illness or death. For the rest of us, the tiny risk of illness from a vaccination versus the tiny risk of a serious illness or death from a virus that's just not in circulation. It's not allowed to be in circulation. It's a shrug of the shoulders choice, isn't it, for many people? Especially when being vaccinated doesn't allow you to travel, doesn't exempt you from quarantine, doesn't even guarantee you can cross state borders or visit a dying relative, let alone go overseas for a holiday. So I've said it before, I should say this again, you won't get super high levels of vaccine take-up unless we open up a bit and get used to the virus actually being around the place. Now, New York City has now lifted all its COVID restrictions, for instance, because 70% of its adult population has been vaccinated. Now, they went through hell with the virus, so the vaccination incentive was very, very strong. And no one suggests we want to go through what New York City or other countries went through, but the point is the incentive to get vaccinated. Here, we're already protected against the worst impacts. The elderly are vaccinated, and our healthcare capacity is immense. We actually seem to be stuck between a bunch of politicians and, I must say, much of the population, gripped by fear and paranoia and determined to try and eliminate the disease and willing to curb all of our freedoms over tiny outbreaks whenever somebody, even if nobody gets sick from them. Then on the other side, there are other people who figure, given all of that, who needs a vaccine? At the very least, we need some concrete commitments from state and federal leaders. We need targets and rewards, incentives, if you like. Perhaps an undertaking that with 70% of the adult population vaccinated, for instance, there would be no more restrictions of any kind, and overseas travel would be back on without quarantine. When a disease is hardly a risk to most of the population, there needs to be a proper, clear incentive for vaccination.